Rwanda, like many other developing countries, faces serious health challenges. One of them is the way Rwandans cook their food.
Amashyiga ya kera ukuntu yakoraga yaravunaga cyane gufatisha bigatanga imyotsi myinshi.
Global burden of disease research from the Institute for Health Metrics and Evaluation showed that the smoky stoves are responsible for many health issues in adults and children, like heart disease and respiratory infections. The health of a whole population could be drastically improved by phasing them out and giving Rwandans a clean burning alternative.
The world is shivering for tobacco, and I'm sure that cook stove problem in area of smoke is far more important in Africa. And it creates so many diseases that we can change many things if we improve the way families are cooking.
As the Minister of Health, Agnes Binagwaho realized that she could only change social behavior if she had the support of all government departments. But the hazardous cook stoves were not her only problem, as she endeavored to rebuild the health system.
After 1994, in July, this country was completely destroyed. The health system, especially where we have most of the people who were very active in the health sector, either killed during the genocide or they fled the country.
She would have to rebuild the health system from the ground up.
There was no drugs, there was no trust in the health sector, and there was also no tools to provide care. So I remember coming back with kilo and kilo of drugs in my bag just to be able to give care when I was traveling.
When resources are stretched, it is often the most vulnerable who suffer most. The global burden of disease research showed that neonatal facilities needed urgent intervention.
2 years ago, the report showed us that more than 15% of Rwandans were dying during the 42 first days of life. This was a shock again. And for doing that, we decided that the next fiscal year will be a year where we'll do more for neonatology, invest more money in neonatology, in education, equipment, ask all hospitals to have awards for neonatology. And now we start to see the benefit of that. Neonates have a better rate of survival, and there is also, we handle better the last period of neonatology and first period of life for children.
I think one thing has been really central in terms of rebuilding the system is really to look at evidence and use of evidence.
Whatever we're doing in the ministry, we always use information. It means we use data. Everything that you present, everything that you really come to either discuss with her, she always asks, show me the science behind it.
Et alors, sur les cartes de vaccination, pas de problème.
Pourquoi ici on a des vaccins de patients complets? Ça nous permet à récupérer des abandons.
Rwanda sits on tons and tons of research and data well kept. If we tap in those information and also triangulate them with the evolution of policies and strategies and also the way we implement, we can really extract the most efficient action to do to respond to a problem.
In the meantime, her efforts to introduce the new smokeless stoves were paying off. The introduction of the stoves had far-reaching health benefits for ordinary Rwandans. This serves as a good example of how an integrated approach based on sound research and evidence-based data can improve the health of a large number of people.
Nk'iyi mbabura y'amakara asanzwe ntabwo nabashaga kuba nayishyira mu nzu kubera yashyushye agasima, ariko ubu ndajyana iyi mbabura y'inyenyeri njyana mu nzu abana ntibagire ikibazo, nanjye nkumva nta kibazo kubera wa mwuka uhumanya uba ntawe uhari.
The global burden of disease, by creating and generating such data, help us to know where we need to invest the next dollar, the next effort, the next education. And we are a country that do policies and strategies evidence-based. So when we have those data, of course, we have to change our policy and our strategies. The way I'm focused on education and on educating people in producing quality data and analyzing them for better work and better service, I don't do that for me. I do that for the generation of my grandchild. And my objective is that in that generation, the grandchild of the most vulnerable grandmammy is safe. Then I will know that my grandchild